Namaste. Thank you, Vaidya Gangadharan, for this introduction. And I'm also thank you for putting Dr. Soumya Swaminathan from WHO at the opening part of this inaugural session, because these are the two angles, that is the Western medicine and the traditional medicine, how actually they can work together and they can complement each other rather than being the competitor, and how they can work together. And it is really very important to understand that one system, it cannot be assessed on the parameters of the another system, and there could be different parameters, but at the same time the goal of the all the systems of medicine in the world, so they are there to improve the quality of life, the humanity, and the overall health. So with this, I would like to share this presentation in which we have tried to demonstrate that how the immunity actually it works in improving the overall health of the people, and what Ayurveda can do to a great extent for the people of not only of the India but all the world. I hope the presentation is seen.
We can see.
Yeah,
Yes.
thank you. So it is important that the optimizing of his host defense mechanism, this the topic that the organizers they have selected. This is a very important topic, and this topic is not only important in the case of pandemics or the infectious diseases or the epidemics, but it is also important for the non-communicable diseases, the other diseases, and so on. So this is really very important topic that you have selected, and we appreciate this initiative. And in this, I would like to mention what Ayurveda mentions about this Vyadik Shamatva, or the whole defense mechanism. The Vyadi word is the disease, and the Vyadik Shamatva is how actually we can prevent the onset of the disease, or how we can protect our body. And Ayurveda has given the two parts of this Vyadik Shamatva, that is the Vyadikshamattva nama Vyadi Bala Virodhitvam and the Vyadi Utpada Pratibandhakatvam cha. So the word this Vyadi Utpada Pratibandhakatva, that is to prevent the manifestation of the disease itself. And it is not only the manifestation, Utpada is the process of developing the disease. So it is stopping the development of the disease itself. As all of you know, those who are from the Ayurveda side, that there are 6 stages of the pathogenesis which actually traverses according to Ayurveda. It is and the Vedic Shamatva. So this talks about the preventing the progress of the pathogenesis in all these 6 diseases. So all these 6 stages of the Samprapti, whether it is in the very initial stage or the Pragopavastha, or whether it is the Prasaravastha, so all the 6 diseases. So when we are talking about the Vyadi Utpada Pratibandhakatva, that is the stopping the process of the pathogenesis in any of the 6 diseases, or even before the pathogenesis starts. So this carries the both the meaning, and at the same time Vyadi Bala Virodhitvam. So Vyadi Bala Virodhitvam means against the disease. So it also works to treat the disease, to cure the disease, and to pacify the disease. So this is a broad term of the Vedic Shamatva, and it is applicable to the promotion of health. As I mentioned, it is the for the communicable diseases, non-communicable diseases, and many more conditions. There are various factors responsible for the Vedic Shamatva, and we must understand that Dr. Soumya, she was mentioning about the innate immunity, and when we are talking about the Vedic Shamatva, it is beyond the immunity. And in Ayurvedic term, the dosha samya is one of the important factor. The Agni, or the metabolism, is another important factor. The dhatu sarata, that is the quality of different tissues. So this is also very important. Because say for example, if we are talking about the present pandemic of the COVID, which is a multi-system disease, now we understand, but the primary manifestation almost in most of the cases, it starts with the rasadushti. And when we talk about the Rasadushti, so the fever is one of the presentation, but at the same time, in many patients, the cardiac manifestation was also seen. The ST depression was also seen, which again could be because of the Rasadushti. So there are various presentation, but the fever could be one, the fatigue could be one. So the Rasa Dhatu is definitely there. And because of that, the optimum quality of rasa dhatu to begin with is very, very important. And those various disease conditions, those who have the compromised the quality of the rasa dhatu, so they are prone to get these kind of diseases, or I would say this specifically to the COVID, and that's what we are calling as the comorbid conditions. The next factor is the oja, and the oja is another concept which is described in Ayurveda. Those who are from the Ayurveda background, those who are having some knowledge of Ayurveda, they would be able to understand easily what the oj is. And there are various methods how actually we can improve the oj. And one of the method is that you improve the quality of all the dhatus, and that will improve the quality of oj. And at the same time, the various diseases like the diabetes mellitus and the cancer and other, so in those kind of diseases or the tuberculosis, the oj is already depleted. And the manas, that is the mind, is another factor which is very important to maintain your Vedic Shamatva. And we know that the psychosomatic these diseases are there, but the importance of mind, and when we are talking about the mind, so that also include the various stress factors and other things which are very much responsible to deplete your Vedic Shamatva or the host defense mechanism, and that also should be equally good. So considering all this, the ministry had issued the guideline during this pandemic, and these guidelines, they are based on this particular shloka which you see in the blue color, and these are the methods how to achieve the Vedic Shamatva or how to improve the host defense mechanism. And this is Nityam Hitahara Vihara Sevi. So Nityam is regular. It is not only once, or it is not once a day or once in a month, and it is not so. It is Nityam, all the time, regularly. So Hitakar Ahar. So there is a lot of discussion is there. What is mean by the beneficial diet? What is the mean by the nutrition? So all this description it is there. And but these various guidelines, they have to be followed regularly every time. So Nityam Hitahara, and it is not only related to the diet, but also the Vihara. Vihara is also very important. Vihara is our lifestyle, that what time we get up, what in the morning, what time we wake up, whether we have clear bowels and all other systems clear, what time we go to sleep, whether do we do the exercise. So all these various factors, and including whether our mind is calm and cool and quiet, or whether we are under stress. So all these various factors, so they are there in the Vihara. So the Hitakar Vihar is also very important. There are lot many research papers which are already published, and they are available in the journals, giving the impact of the stress, giving the impact of the lack of sleep, and how actually it impacts the overall system of the human body. The circadian rhythm research paper, it was recently published 2 years back, and it also got the Nobel Prize. So all these various mechanisms and the various principles which are there in Ayurveda, so they fall under the category of Nityam Vihara also. So Nityam Hitahara Vihara Sevi Samikshakari. Samiksha, that is, you have to analyze that what is good and what is not good. Samikshakari and Visheshu Asaktaha. So that means there should not be excess of indulgence. So this each and every word is very, very important. Visheshu Asaktaha. We should not get excessively indulged in any kind of object, any kind of, whether it is the our work, whether it is our lifestyle, whether it is the food, whether it is the money, or whether whatever it is. So in any kind of subject, we should not get excessively attached to it. So that is very important. And the second line is very, very important considering the mental aspect, and not only the mental aspect, the spiritual aspect also, because it says that one should be data, we should have the tendency to donate, we have the tendency to give, and this is very important. So dataha samaha, we should look at everybody equally, so that there should not be any stress. If we favor somebody and if we hate somebody, so that will give rise to some kind of stress. So these data samaha satyaparaha kshamavan aptopasevi cha bhavati arogaha. So these are the methods how to be healthy, how to maintain our health. And there are also the characteristics how actually we can assess whether somebody is healthy or not. And these characteristics, these are mentioned over there. These are the actually parameters. In the definition of Ayurveda, it has said that what is Ayurveda? So at the end of this shloka, the Charaka says that Manam cha taccha yatharokta. Manam is the quantification. So whatever the various advices and the rules and other things which are given in the Ayurveda, so at every time there is method to quantify, to assess. So all these assessment methods, they are also there. These assessments methods are have been described very clearly, and these are the quantification methods. So here also with the characteristics, that is how would you assess that somebody is having good defense mechanism or not. And here it is mentioned that samamausa pramanastu. So the distribution of the muscles, it should be and their presentation, it should be equal. The overall the body presentation, it should be equal. The it is given in the anthropometry that what should be the overall measurements of each body part. So when your body is proportionate, so that automatically gives you the Vedic Shamatva, or the whole defense mechanism is good. So this is the overall the samamausa pramanato sama samhono naraha drunendriyo vikaranam na balena abhibhuyate. So this is very important that vikaranam na balena abhibhuyate. So they do not fall sick very easily. So this is one of the actually reference which is directly there in the ancient text, that when you have good Vedic Shamatva, when you have good host defense mechanism, in that case you do not fall sick very easily. So this is very, very important. And on these two slides which I mentioned, on this basis the Ministry of Ayush during this COVID pandemic, it created the guidelines for the community that how actually you should improve the immunity. And I am happy and proud to share with all of you that probably the Ministry of Ayush, Government of India, was the first one in the month of February 2020 to these issue guidelines to improve the general immunity of the people to keep themselves safe during this COVID pandemic, because nobody at that time knew that what kind of the disease it is, what would be the medicine, whether we can prevent it or not with any kind of vaccine. So nothing was available that time. So that time the Government of India, Ministry of Ayush came forward and issued the guidelines. And these guidelines, they also mention about the overall hygiene, the safe distancing. Now this hygiene and safe distancing, they are also rather the principles of Ayurveda, because Ayurveda knew that how the infectious diseases they occur. It is said that prasangat, gatra sansparshat, nishwasat, sahabhojana. So gatra sansparshat, that is by touch, and the nishwas is by breathe or the droplets. So all these mechanisms, they have been described in Ayurveda. And the overall this guidelines which were promoted by the WHO, and the same were being promoted by all the countries, including the Ministry of Health and Family Welfare of the Government of India, as well as the Ministry of Ayush and the various offices of the government. So these knowingly or unknowingly, they actually promoted the guidelines of Ayurveda. And at the same time, the use of the rasayana herbs, the prophylactic care, the add-on or standalone mild to moderate cases, and these lifestyle and yoga. So these were the various aspects of the guidelines that the ministry promoted, and that include drinking the warm water throughout the day, use of the concoction made up of basil, cinnamon, ginger, pepper. Now there are a lot many research papers which are available on these all various kind of medicinal plants, whether it is ashwagandha, whether it is ginger, that how they improve the immunity of the people. So all these they are well published. At the same time, the very novel intervention the ministry promoted, it is the nasal application of the medicated oil. And there are also we are now conducting the research with the Department of Science and Technology on the Nasya method, that how actually it creates a barrier and that prevents the entry of the virus through the nasal mucosa. So this is the very innovative mechanism that the Ministry of Ayush brought forward, and the Chyawanprash, and there are lot many papers which are already available on the Chyawanprash and Amla, that how it improves the host defense mechanism as well as the innate immunity. And these guidelines they were promoted throughout the country, and not only throughout the country but with the help of the Indian missions throughout the world. And these were followed by almost 90 to 95% people in India. And we conducted a huge study through the mobile app on this, that how many people they actually really followed this and how much they benefited. And you would be happy to see the interesting observation that more than 135 million people they submitted their feedback regarding this following. And 89% people they said that they have benefited with these guidelines. So this is a huge response that the community has given to the Ayurveda intervention. And it is not only that, beyond that, we also conducted various studies and the hardcore research trials, whether they are on the prophylactic or whether they are on the curative side. And these are the various results that I would like to show. Now, in this particular intervention, the Ayurvedic intervention was given like the ashwagandha as well as the Tinospora cordifolia, that is the guduchi or the Samshonivati, in the Delhi population. And on this yeah, blue graph, blue line, you can see that the overall incidence of Delhi population, it was increasing. At the same time, this intervention was given in the population in the containment zone, and in that population this graph it showed that how it dropped down. So on one side in Delhi population the incidence was increasing very drastically, and at the same time at the end of the fourth week the incidence in this containment zone where the intervention was given, so it dropped down significantly. At the same time, we also tracked the symptom wise how actually they improved. And here actually you can see this blue line, blue graph, so that indicates the Ayurveda intervention, that is the AYUSH 64, and the red line, so this is the standard care. And here you can see that how the Ayurveda intervention it has helped significantly. And these are very large population. There all the population, this sample size in thousands. And here everywhere you can see that how significantly it helped to improve their not only immunity but improve the overall response to the COVID. And at the same time we also conducted the hardcore scientific studies, and in that out of 36 compounds from the various ingredients, there are four ingredients in the formulation I 64. So the 35 compound they exhibited good binding energies than the positive control of the N3. So these studies that also we conducted in the initial studies, and to find out that whether our logic is correct and whether we should go ahead with this. And this demonstrated that the logic of the ministry, so that was very correct and it would definitely help. And with this we intervene when the to improve the immunostimulatory response of the people. And here also in this graph you can see that how it improved. That this is in the Delhi police. The intervention was given to 80,000 Delhi police, and this was continuously given for 2 months. And here actually you can see that the overall when the peak was there, so at that time the overall incidence in the Delhi police it was hardly 6. So this was this was the outcome of the intervention, and that showed that how the immunity improved. And we have also taken these samples and they are being analyzed that to find out what were their responses to of the various biochemical parameters as well as the other parameters, and how they improved with including the immunoglobulins and other things. One interesting thing I would like to show here that during this pandemic, in the All India Institute of Ayurveda, the incidence of the COVID-19 in the host in the healthcare or those providing the services. So in that it was zero. So it is very important that out of 200 people, those who are providing the services in the COVID ward, none of them they caught the infection. This is another data, and at the same time, it is important to see that in other hospitals where the COVID care was given, so there the incidence of catching the COVID in the healthcare providers was almost 30%, whereas here not a single case it actually got the COVID. So likewise, all these various data are there. This is the data which shows that how the RT-PCR it was quickly negative. So compared to the conventional method, the RT-PCR, we found that within 7 days, the people with the COVID positive, so they become RT-PCR negative. So the symptoms they become negative, or the people they become asymptomatic within 2 to 4 days, depending upon the intensity of the symptoms, and they become COVID negative within 7 days. So this is again a very important observation that I would like to share with you. And at the same time, we also conducted the studies on the other Ayurvedic drugs, that how actually they improved the immunity in the healthcare worker, and these were the exploratory studies, and they showed that the various parameters like the hemoglobin percent was increased. There was an increase in the platelet count. There is increase in the serum immunoglobulin G level, which scientifically demonstrates that the immunity was significantly improved. And this is one more slide which I would like to share with you. And this is again 11,964 patients they were treated of mild to moderate category, and this was managed by ITBP, that is Indo-Tibetan Border Police Force, in the Sardar Patel COVID, and they were given the Ayurvedic decoction and the Chyawanprash and the turmeric milk, and this is the data that how they actually responded. So out of this 11,964 people, so 11,594, so they totally cured and they were discharged. So this is a huge, so very good clinical improvement was seen in the patients, that is 96.9%. So this is the huge the response that we received, and this shows that how the Ayurveda intervention can improve your host defense mechanism. So thank you very much. Thank you.